How does pain relate to Pisa syndrome in Parkinson's? How does pain relate to Pisa syndrome in Parkinson's disease? This connection is significant and multifaceted. Pisa syndrome is a condition that affects some individuals with Parkinson's disease. It is characterized by a noticeable bending of the trunk to one side, which often becomes more pronounced when standing or walking. Interestingly, this bending tends to improve when lying down. Research indicates that approximately 7.4 to 10.3% of people with Parkinson's disease experience Pisa syndrome, and it can greatly affect their quality of life. Pain is a common symptom associated with Pisa syndrome. The abnormal posture and lateral flexion of the trunk create uneven mechanical stress on the spine and surrounding muscles. This can lead to musculoskeletal discomfort, particularly low back pain. The distorted posture places strain on the axial skeleton and the muscles along the spine, which may undergo changes due to prolonged abnormal positioning. The relationship between pain and Pisa syndrome can be understood through two main mechanisms. First, there are peripheral musculoskeletal factors. The lateral bending of the trunk causes asymmetrical loading on the spine and soft tissues. This can lead to muscle fatigue, inflammation, and pain. Over time, these issues might result in structural changes in the spine, such as scoliosis or deformities, which can further worsen pain and limit functionality. Second, there is central nervous system involvement. Pisa syndrome is thought to involve not just musculoskeletal issues, but also central mechanisms related to Parkinson's disease itself. Dysfunction in certain brain circuits and altered sensory-motor integration may lead to abnormal muscle activation patterns. These central factors can affect how pain is processed and perceived, potentially intensifying the discomfort associated with Pisa syndrome. Additionally, Pisa syndrome often affects balance and mobility. This can increase the risk of falls and secondary injuries, further contributing to pain experiences. Pain in individuals with Parkinson's disease and Pisa syndrome is primarily linked to the mechanical and structural consequences of the abnormal trunk flexion, along with the central nervous system dysfunction that is characteristic of Parkinson's disease. Recognizing and managing this pain is crucial for improving the quality of life for those affected by Pisa syndrome. A comprehensive assessment of posture and pain in patients with Parkinson's disease who present with Pisa syndrome is essential. Multidisciplinary approaches that include physical therapy, pain management, and optimizing Parkinson's treatments can help address both the peripheral and central contributors to pain.